What do you think is affecting the universal healthcare concept, and why do you think it may be quite difficult to achieve it if we continue playing the way we are?
I think we have three key challenges that I can pinpoint. The political leadership and the will to do something that will take us forwards towards achieving universal healthcare. What I mean by political leadership and that will is that really people can pronounce whatever they want to pronounce in on top of that cruises or in churches or in political meetings.
Yes.
But I think action speaks louder than words.
Yes.
And the actions that would tell me that we are going to make a lot of effort towards, or we are going to achieve primary health care are one. Is the political leadership in this country willing to set aside a significant amount of money from the annual budget towards healthcare? That's item number one. In Abuja, there is the Abuja declarations, who said that countries were willing to devote 15% of their annual budget for healthcare. Unfortunately, in Kenya, our annual budget for healthcare is between 6 and 7%. I don't think it has ever hit anything 8 or 10%. And this is way too low. That's item number one. To allocate enough resources. The second issue, that is the political commitment and the political will to fight corruption.
Yes.
In healthcare setting, there is massive corruption. You have heard of the COVID billionaires.
Yes, yes.
You have heard of the medical equipment that was supplied. And every day, there is a major scandal in the health sector. We allocate so much, but then a significant portion of that money is lost to corruption and corrupt deals. This has nothing else to do. It has to do with leadership. And the leaders willing to clamp down on corruption. The third item on that particular subparagraph of political commitment, I would say is, are we willing to commit a significant amount of resources to our primary healthcare networks? If you look at the budget, I told you the national budget, healthcare takes only 7%. Primary healthcare facilities take a very, very small portion of the national budget, of the national health budget. Sometimes as little as 4%. You can imagine.
So
4%.
7% they take only.
Not 4%.
Yes.
We're talking about the total health budget. Because when you bring that budget, you find that tertiary health facilities, like International Hospital more teaching and referral, spinal unit, Kenyatta University Teaching Hospital. Those specialized institutions take 40% of the budget.
Wow. Wow. And they're just a few.
And they're just 4, 5, 6, or 7. Certain small portion goes to research institutions like Cambridge, blah, blah, blah. Small portion. So what gets to primary healthcare facilities is a very, very small portion. And most of the challenges, the health challenges we have in the country, if we were to look at issues of morbidity, that is disease, and mortality, that is death, the vast majority of our population, the illnesses that affect them most are respiratory tract infections. They are affected by issues of diarrhea or gastroenteritis, malaria, HIV. Those are the most common causes of morbidity.
Daktari, pole sana to interrupt you. Lakini I would like us, because we are talking to a Kenyan, sisi kama wa Kenya, even me included, we are not versed in the medical practitioner, maybe with the medical jargon and all that. Mkenya angetaka kuelewa, what are these respiratory tract infections and all that? Maybe could you shed some light on that?
What I would say is, wengi wanajua kama mapua, homa, pneumonia. Those are the commonly
Asthma.
Those are the respiratory tract infections that we find most of the time. Diarrhea diseases. Basically, diarrhea is diarrhea. Kuendesha.
Yes.
Malaria unaumwa na umbu. Halafu malaria. And then HIV, you know. So these are the most important causes of disease in our country. And they are also the most important in terms of causing death.
Yes.
But when we are allocating resources, we allocate more resources for tertiary institutions at the top there instead of the where 80% of our population live. So, in the healthcare pyramid, the tertiary receive the most, yet they don't, most of the work in healthcare is not in Kenyatta. Most of the work in healthcare is at a dispensary, health center, and for hospital. But that is where we are starving. That is where we are not getting enough resources to. Hawana pesa hawa.
So it means we have misguided policies and maybe misguided budgets. Does that mean that?
Somebody needs to realign the budget to the realities of the people.
Thank you for watching your healthcare podcast. Watch out for episode 2. Like, subscribe, and follow. Afya Yetu Podcast is for you.